Hi, I'm Dr. Mollie Marti with Resiliency Matters. What if you could learn the health habits of people who live well into their 100s? Would you spend the next 28 minutes with us? What if in the next 10 minutes you could learn ways to shed stress? Would you hang out with us? Who is us? My other half today is Stephanie Neff. Stephanie is Health and Wellness Supervisor for Cedar Rapids Community Schools. Formerly, she was Deputy Director of Linn County Public Health and Program Manager for the Cedar Rapids Blue Zones Project. Stephanie is a leader in helping communities identify and respond to health priorities, and she has been a big supporter of our work at the National Resilience Institute, for which we're very, very grateful. Welcome, Stephanie.
Thank you. Thanks for having me.
Very happy to have this discussion today. Let's jump in with the Blue Zones Project. I think it has a fascinating beginning, the origins of it. How did the project start?
So Blue Zones Project itself is a community well-being improvement initiative designed to make healthy choices easier for people who live, work, and play in communities. And the background of that is that a gentleman named Dan Buettner was funded by National Geographic to do some research in the places where people lived longer, better. So they were living into their hundreds, but not just living, having a great quality of life, not experiencing the rates of chronic disease that we experience in many of the communities in the United States and in North America. And so he went and researched these communities, and they include Okinawa, Japan, Loma Linda, California, Ikaria, Greece. And what he found is, what he and his research team found was that there were certain principles that were common in all of these places, and they called those the Power 9 principles. And so the Blue Zones Project is taking that research and trying to replicate those principles that helped create healthier environments in other communities throughout the United States.
Great, and to give our viewers an overview of these Power 9 principles, we're going to put a slide up on the screen, and Stephanie, you can walk us through these 9 principles. We're going to be talking about many of them today in our conversations, but I think an overview would be really helpful.
Sure, so you can see the Power 9 principles now. Starting at the bottom with belonging to some kind of faith-based or spiritual community was important in all of the areas that Dan Buettner did his research. Eating with a plant slant, moving naturally, family first or loved ones first, kind of taking time to build relationships with people that are close to you. Wine at 5 for those who have a healthy relationship with alcohol, and that's 1 drink a day. Can't save them all up until Saturday. Downshifting, knowing your purpose, surrounding yourself with people who have similar healthy behaviors or having the right tribe, and then the 80% rule. So being mindful when you're eating and stopping before your body tells you that you're overfull and have eaten too much.
So why are these principles important to our viewers in their communities, in their lives now?
Sure. So the principles of the Power 9 principles are important because in Iowa, 15 communities have become certified Blue Zones communities. And really, this is a national movement towards healthier communities as a whole, and trying to find out the ways that that communities can support individuals in making healthier choices. It's not just about telling somebody that they need to eat better or move more. It's about creating those communities where that actually takes place. And so all of those communities that are certified Blue Zones communities worked in 6 sectors. So schools, work sites, restaurants, grocery stores, individual engagement, and community policy to make those changes. Many of the communities outside of those 15 have adopted similar standards, and so as a state in Iowa, really that has resulted in our well-being score improving at twice the rate of the national average, which is pretty significant, because some communities are actually declining, others are just kind of holding steady in their well-being overall, and we are improving at twice the rate of the national average, so pretty impressive.
It is impressive, and it's wonderful news. So in your work, I hear you talk about mental health a lot, or wellness. What exactly does that mean when you reference those terms?
So wellness is a little bit different than health, or sometimes people refer to mental health in the context of mental illness, which is more of a diagnosable condition, rather than well-being or wellness, which is more comprehensive. So we're looking at the whole person rather than just one element of the person. And so well-being would include not only physical well-being, so being free from chronic or acute conditions that need physician attention, but also that mental emotional component. Some areas include intellectual well-being or financial well-being, which can be a significant source of stress for some people, the spiritual well-being component, and then even environmental. So how are the conditions, the water you drink or the air you breathe, influencing your overall well-being? So it's much more comprehensive term than just looking at mental health or physical health in isolation.
Okay, so whole person, holistic. And I think in conversations, certainly media, what we get from media, but even in daily conversations, we're more likely to hear mental illness than mental health. Do you think it's important, the use of language, the choice of words in this area of wellness?
Absolutely. Language is critical to addressing some of these conditions, both in the environment and in individuals, because when we use certain language, people that make something click in their head. They have a certain experience with someone who had a mental illness, and so it generalizes across any other experiences or conversations that they have. And one of the important things about well-being or seeing things in a larger context is to be able to have that dialogue around what are really the conditions that are influencing those various aspects of well-being, and how are different groups of people or individuals responding to that. And so when we talk about language, even something as simple that people can do that is not often thought of as critical, but can really influence people's emotional or mental health one way or the other, is instead of asking what's wrong with you when somebody is maybe dealing with a stressful situation, or maybe exhibiting some kind of a behavior. We do this often with children, but certainly it happens with adults too. What's wrong with you? Ask what happened to you. Tell me about it, and encouraging them to kind of process it through and gain some kind of closure or perspective on what the situation is. And that can really do so much for the mental and emotional well-being component.
Certainly. So thinking back to when we put the 9 principles, which I know you know forward and backwards and up and down, which of those principles deal with this concept of emotional well-being?
I would say that probably all of them are very comprehensive, but the one that stands out for me is really downshifting. And that's really about being intentionally mindful, being in the present moment, thinking about what you're doing, and building that into part of your routine.
And Blue Zones often calls that, I think of it as shedding stress. So to wrap up this segment, what are some tips or some recommendations you can give around how do we downshift effectively?
Downshifting means different things for different people. It's really taking a break away from kind of the daily grind of life, stepping back, showing gratitude for things that you have, building relationships, investing in relationships. Some people practice meditation or yoga, but it can really be as simple as just closing your eyes, taking 3 deep breaths, letting your body and your brain just process the current moment before you kind of move on and jump into the next activity.
Nice. And really, since I became familiar with the Blue Zones, I actually have a visual of that downshift. I grew up on a stick shift, so it works for me, but just taking that break. So there's tool number 1. Downshift. We all have stress, and we all need routines to shed stress before it leads to chronic inflammation and disease. Find a routine, have fun with it, play around with it. Find one that works for you and use it daily. How can your social networks strengthen your health or set you up for failure? Stay tuned. Hi, Hi, I'm Dr. Mollie Marti. Welcome back to Resiliency Matters. We are visiting with Stephanie Neff, a leader and expert in community health, and we've been talking about the Blue Zones Project and the Power 9 principles. About 3 of those principles have to do with social connectedness. What are those?
The 3 that connect or match mostly with social connectedness are really belonging, and so that sometimes is perceived as a connection to religion or faith. It can really be any spirituality, but the intent behind that is really that you're connected with people who have similar beliefs to you. So you belong to a community that community within a community, if you will. The second one is loved ones first or family first, building those connections and relationships. And then the third one is the right tribe, surrounding yourself with people who encourage healthy behaviors rather than spread kind of negative feelings or interactions.
And how do these principles of social connectedness impact well-being?
Social connectedness has been found to have a significant impact on well-being, and it's often not kind of discussed when we have the conversation about well-being. Researchers from University of Chicago actually broke it down into 3 different levels of connectedness. So intimate connectedness and relationships, relational, which is more face-to-face contact, really not electronic connections, so people feel connected when they're really not, and then collective connectedness. So being connected with something that's larger than yourself. And the opposite of connectedness then is loneliness. And so feeling isolated, which often is something that accompanies mental illness or poor mental health, poor mental well-being. But loneliness can have significant negative impacts on overall well-being in an emotional and a physical sense as well.
Okay, and when you mentioned the research on being connected to something bigger than yourself, that brings to mind another principle, which I saw on their purpose. How does that fit in here?
Right, so that's a key component. People who have a sense of purpose, and in the Blue Zones, the original Blue Zones areas, when Dan Buettner did his research, he really found this very strongly, that people had a reason for getting up in the morning, that they woke up and they had something that drove them to kind of get out of bed, get motivated, get moving. And really it doesn't matter what that is, but part of having that purpose really means being connected to your community. So they're linked together in that your purpose can be something that you have that's unique to you that you're giving back. So some people get to do that in the job that they do every day, and that's a great fit. Some people do it through volunteering, finding a way to just be part of enhancing someone else's life. And that then in turn enhances connectedness. And then of course, the more you live out your purpose, the more you build your social networks with people who have a similar purpose, and so it decreases those feelings of isolation that may lead to negative health outcomes.
And something I remember Dan saying the first time I met him is that when you know your purpose, if you put your foot on the floor when you get out of bed in the morning and you know why you're getting out of bed and who you're going to help, that adds 7 years onto one's lifespan. Is that still accurate with the research that?
Yep, that's what his research kind of showed, and I think it's been supported by other research, is that it can really have a significant impact, and not only longevity, but also the quality of life and how people feel about their interactions day to day in the world, and
So what barriers do communities face in trying to build and support this social connectedness?
I think a couple of things that can be challenging from a community level. Oftentimes we make the assumption that it's just something that kind of comes naturally when it may need to be more intentional, particularly in a fast-paced, busy world. People who have families, especially, they're shuffling the kids around to activities and they're working. Some people are working multiple jobs, and so taking the time to intentionally connect. And in communities, that means making it a priority to set up that space, so creating that environment that can facilitate social connectedness. So having activities or events or things for people to do, places for people to engage with one another and actually meet face to face and kind of be social. I think another barrier certainly is technology. that feeling of being connected with people, but not really being connected with them, because that face-to-face component it really defines connectedness versus, texting or being on the phone with someone even.
And the risks are real if a community isn't building this social cohesiveness. What have you seen? Of course, I think of disasters and the ability or inability to respond. But what are some risks to a community if they're not doing this work of building these social connections?
The networks are really important in a community's ability to respond to any kind of disruption. That could be a man-made disruption, it could be a natural disaster, anything that impacts, even a small population within a certain community. People who have those relationships, have that connectedness, and have those networks built up, find it much easier to respond and recover because people bring assets and resources that individual or that group of people or that area, that geographic area, might not have otherwise. And so it's really all in the connections, and there's a difference between, calling and asking for something from somebody that you've maybe met once, and I have a relationship, I'm connected with this person, I know what skills or talents or resources they're able to bring because I've had that relationship with them. And then we can kind of all come together and bring that to the table to form a positive response with a good outcome.
And I'm going to share break format a little bit, but just we had a conversation on the way here of what you were doing, and you were at a meeting yesterday, and you just made the point, an observation, how many people around this table know each other? How many people know everybody else in this room? Mm-hmm. And what a great simple question, so that you parents, when you walk in to something at your child's classroom, do you know those kids' names, or do you know the other parents there, or in your business situation, do you know each and every person there? And it's just it was a great reminder to me, and a great tip that we can take these big concepts like social connection and make them very real. Are you tapping into and introducing yourself and connecting with and getting to know the other people that you are working with and playing with on a daily basis? So there's tool number 2, that idea of connection and being impacted by others. Our choices, positive and negative, are contagious. Surround yourself with people who favorably shape and support healthy choices, and we would add, continue to get to know the people in your life. When we come back, we will continue to talk health and wellness. Hi, I'm Dr. Mollie Marti, and welcome back to Resiliency Matters. We are speaking with Stephanie Neff, Health and Wellness Supervisor at Community School District here in Cedar Rapids. And you also have done a lot of work that I find fascinating in the area of food. It's one of those core basics, foundational pieces of wellness. Share some of the work that you've done around food and how it serves as a fuel for wellness and resilience.
Right, so the way that food ties in with resilience is that it really creates a foundation for well-being. If we look at the traditional definition of health, or how some people have the perspective of, oh, health is just about eating well and getting physical activity, and then even there, and if you look at basic needs being met, food is a critical component to body development, mind development, the capacity to be able to respond to stressors in the environment. And so it has become very clear that those linkages exist when we talk about food, and that it's not just about providing healthy food, because some people have access to food, but it's not necessarily providing them with the nutrition that they want or that they need in order to build that foundation for resilience. And so the issue of food insecurity and resilience, I think, are very closely tied, because that does create a stressor, more of an environmental stressor, but then also that leads into a physical stressor of not getting that nutrition that's needed.
Mm-hmm. And this is really an international level. I was just having a discussion with Terai Tren, a former, you know Terai, but a former guest on our show. And she built a school to educate children in Zimbabwe, and that was her issue. Let's educate them. It's their pathway forward. And then she realized, oh my goodness, I need to feed these children. They walk up to 5 miles each way. We have them for 6 hours, and some of them haven't had a bite to eat the whole time, and they can't become educated. They can't even absorb that knowledge when they're not absorbing the nutrients. So
Yeah.
it is such a pivotal foundational piece.
Right.
You also, this is why I can talk to you all day long, you go from the foundations of nutrition and sleep and rest and downshifting and all of these practicalities to all the work you've done on the policies and the procedures around building wellness and resilience. How do those policies and procedures impact and can support or impede resilience?
So one example of that specific to the food is that when we started addressing food insecurity and saying this is an important issue not only in well-being but also in resilience, we realized that if you go back to Blue Zone's principles, people who are living longer, better, are eating mostly with a plant slant. We live in Iowa, typically, you know, the Midwest and agricultural community. So people often make the assumption that, you know, there's plenty of access to fresh produce, and that's not necessarily the case. There are often kids who maybe are getting food, but it's highly processed food, which also creates a stressor on the body versus eating with a plant slant. And so one of the things that we started working towards is how do we grow food locally in our communities, and how do we integrate that into education, from a lifelong learning standpoint. And so some of the programs that we started implementing were using vacant lots or extra land at churches or school property to build gardens where children and adults could be engaged in growing food and actually take that food or have it donated to food pantries. And so programmatically, that was one of the things that was a goal for us. But as we started working through that process, we found that there were some barriers in terms of how we were able to use the land, what was okay, what was not okay. And so we worked with the city and city officials to change some policy to make it easier to grow fresh produce on different types of property and still be in compliance with kind of the process from a policy standpoint. And so policy helps us kind of alleviate some barriers because it can be a little bit restrictive at times. And so we were able to join those two things, and as a result have lots of urban farms now on various properties, and lots of people engaged in that to grow healthy food. And
I just think in my personal life and community, the plots on the church property that we attend, the plots at the schools my kids have attended, so I've seen that growth over the few years. You were on front lines with the Blue Zones project in Cedar Rapids of really how do you get a community to get their minds and hearts wrapped around these healthy choices and making them the easy choice and moving forward. What would you say is the biggest challenge to a community in this area of growing wellness?
I think part of the challenges, going back to social connectedness, are really building the relationships across boundaries or across sectors. So every individual works to build their own purpose. And those purpose, they might align on some level, but they're kind of different. So people are headed in different directions, organizations are headed in different directions. And so without a really true, deep conversation about where are we all connected and what do we all have in common, trying to determine what the solutions are to some of these really big systemic issues that influence health and well-being and just generally our community's vitality and livability, need those discussions to happen, because if you don't see a value in something that I'm doing, then you won't get on board with it. So finding that piece of what connects your work with my work can help us work together to have a greater impact.
And again, you've done such great work for the National Resilience Institute in facilitating some of those conversations. So this has been a great conversation today. Here's your tool 3 for our last segment. Ready to build resilience? Start with your fuel. Eat more plant-based food, stop eating when you're 80% full, and make your evening meal the smallest one. And then add some natural movement. Walk rather than drive, and go play. Always remember to go play. This is Dr. Mollie Marti with Resiliency Matters. Thank you for joining us on MediaCom MC22, your local programming leader.